So in total today there are 3 new cases to report. One case is a returnee detected in managed isolation, and there are 2 new community cases. One of these is connected to the November quarantine cluster. This case is a close contact of case B in that cluster and tested positive on the 11th of November after developing symptoms. That person, we are calling case C, had already been in isolation since Saturday, as had the members of their close family, and they are in quarantine at the Grand Mercure here in Wellington. I will provide some more information around the November cluster shortly, but moving now to the case that the Minister has talked about. We are reporting this community case in Auckland, for which we continue to investigate the source of transmission. The person became symptomatic on Monday the 9th of November. They were tested late on the 10th of November, and they went to work at the A to Z collection on High Street from Sunday the 8th of November to Wednesday the 11th of November. I'll come back to that shortly about our instructions or requests to people who may have been there. The positive test was just confirmed this morning, mid-morning, and the person is being moved to the Auckland quarantine facility today. This, to start with, is a very important reminder of why anyone with any symptoms of a cold or flu get tested, and our request is to stay home until you have the results of that test. Auckland Regional Public Health is interviewing that case further. They have already had an initial interview to identify close and casual contacts and to further understand all their movements, not just since they became symptomatic, but in the preceding week or so. So that is, in the first instance, to identify who may have been in contact with the person since Saturday the 7th of November, but also going back to see if we can ascertain, of course, importantly, the source of this infection. The person does live alone and appears to have had limited community outings recently. They have not visited a supermarket during the period they might have been infectious. Whilst the person is a student at AUT, they have not been to the campus or to any lectures or classes since mid-October, so there is no concerns with any potential exposures on campus. At this time, and as a very precautionary measure, we are asking people who may have visited the A to Z collection store at 61 High Street in central Auckland, and or who is a resident at or a visitor to the Vincent Residency at 106 Vincent Street in central Auckland. The dates of interest are anyone who has visited those 2 locations, or indeed in the case of the apartments lives at the Vincent Street residences between Saturday the 7th of November and today, the 12th of November, to seek a test and isolate until you receive the results. As usual, anyone in the Auckland region and indeed wider New Zealand who has cold or flu symptoms should get a test and not go out, but stay at home, not go to work or school or study until you have had a negative test result. There are details on where people can get tested in central Auckland or anywhere in Auckland if they have visited either of those 2 venues on the Auckland Regional Public Health website, and we will update during the afternoon on additional pop-up testing sites for people close to those venues that will be made available. There will be additional locations of interest, and as soon as we identify that, we will send push notifications via the app and provide wider public messaging. We are, as I said, also getting that additional testing, which should be available later today, and we will let you know the locations of that testing. We're urgently working to trace the person's movements so that we can identify not just people who may have been in contact, but where the infection may have come from, and genome testing has been urgently undertaken overnight to see if we can identify a link with our existing cases that we already know about. At this stage, we are not advising of any change to other settings, and we will be constantly reviewing those as further information comes in. Anyone with any concerns about today's news can ring Healthline's dedicated number 0800 358 5453 for advice. Amongst other usual details report, our imported case that I spoke about arrived on the 9th of November from Los Angeles. They have returned a positive test at around day 3 of their stay and are now in the Jet Park quarantine facility in Auckland. 2 previously reported cases have now recovered, and our total number of active cases is now 53. And our total number of confirmed cases to date since the start of the outbreak of the pandemic earlier in the year is 1,635. And yesterday our labs processed 6,581 tests. So just back to the November quarantine cluster, we now have the 3 people connected to that cluster. The case C, which I've just spoken about, is a civilian New Zealand Defence Force worker and a close contact of case B. They were part of a lunch outing in Wellington at the Little Penang restaurant on the terrace on Friday afternoon last week, and on developing symptoms on the Saturday they had isolated at home and had a COVID test. Although they initially returned a negative result on day 3, they were moved to quarantine as a precaution on Tuesday, and a second test yesterday returned a positive result. Should say we've asked the lab about that earlier negative test, and they're very clear that it was a negative test. So push notifications have previously been sent out for the Little Penang restaurant on the terrace, which closed for a deep clean earlier this week. It was visited by cases B and C, as I said last Friday. However, just advising anyone who did visit that restaurant last Friday to between 1 and 4 p.m. to be very aware of symptoms and isolate and have a test if they are symptomatic. The household contacts for this latest case, case C, are in isolation already. They have already been tested and returned negative results. They will be remaining in isolation for the full 14-day period and retested as part of that. All other close contacts of case B have returned a negative test result. So, of course, our thoughts are with these 3 people and our other people who have currently got COVID-19 infections, and we wish them swift recovery from those infections. And just finally, we now have 2,349,000 registered users of the COVID Tracer app. And just a reminder to everybody, you never know where and when that information will be useful. Please do continue to scan QR codes wherever you go. Thank you, Minister.
Thank you, Dr. Bloomfield. As Dr. Bloomfield has indicated, our immediate response to any community case of COVID-19 is to gather as much information as possible about the case's movements and the likely source of infection. That's the process that we're engaged with at the moment. As information comes to hand, we will share that as quickly as we're able to, and alerts will be issued through the COVID Tracer app to those people who may have been in the same place as the potential case. I want to reiterate what we've said all along. People are not the problem. People are the solution. It is the virus that is the problem. Everyone has a role to play in responding to any cases of COVID-19, and we all have a role to play in continuing to take preventative measures so that we stop any potential spread. If you live in Auckland and you have any cold and flu symptoms, please contact Healthline and organise a test as soon as possible. If you do have cold and flu symptoms, please isolate. Don't go to work and don't have contact with others. We will be setting up further community testing stations, but we need to ensure that those who need to be tested can get a test and they are at the front of the queue. So in the first instance, we need people to get tested who may have had contact with the person or those people's contacts or those who are showing symptoms. If you're out using public transport, please wear a mask. Please observe social distancing. If you're flying in and out of Auckland, please wear a mask. We'll provide further advice on mask wearing later once we have further information. But in the meantime, it is a simple action people can take to protect themselves and to protect others. Testing and isolating are the key to circling the virus and to stamping it out early. While we're gathering information, we need everybody to take responsibility for doing the right thing. As I said at the beginning, we're sharing this information early. We're still gathering further information, and we will share that as it comes to hand. So till then, we want everybody to keep calm, follow health instructions that we've just provided and any other instructions that may come out, take simple precautions like mask wearing, scanning QR codes, and so that we can help to quickly contact trace if we need to. And of course, as always, if you're sick, please stay home.